Hi and welcome to ESS 2024. My name's Ryan, I'm the Managing Director of Simulaids Limited. We're a 25-year-old company which specialises in healthcare simulation. We have over 3,000 products which vary all the way from basic life support all the way up to advanced life support and into the artificial intelligence and virtual reality world. Where this is becoming more enhanceable in the blue light and pre-hospital care world is with the introduction of endpoint assessments with apprenticeships with the likes of Basegreen and awarding bodies such as Future Quals entering in the apprenticeship market and helping those paramedics or students get to a clinical level which is enhanced for their clinical professional. So I'll give you a show around of the stand. Obviously I just briefly mentioned that we've got over 3,000 products. Now when we come to the emergency services show we can't bring everything with us. So what we do bring is a representation of what's going to be well thought of in the pre-hospital care and blue light ambulance service. So what we're looking at here is our full body ILS mannequin. The reason we bring this to the blue light service shows and the emergency service shows because it really fits in well with all the police, fire, ambulance, search and rescue. Anybody that's going to have that initial impact arriving on scene in those emergency scenarios. The ILS mannequin for the immediate life support allows us to do basic and advanced intubation, CPR, and as you can see on the mannequin, we've dressed it up with makeup and moulage to simulate, in this instance, an RTC crash coming off a motorbike. But this can be changed in any scenario or any situation that you require for your learning outcomes. As mentioned earlier, we paired this with the skill cube. So not only when you're doing apprenticeships and assessments, we can enhance the scenarios that students are faced so they don't see it for the first time on the road. It allows us to do normal patient physiology or we can do into emergency patient physiology. It allows us to enhance away from using live devices which we're a little bit restricted to in what we can represent against mannequins. In this situation, we can represent quite clearly what this patient is going through in the situation that they're in. So as we just saw there, we did have that full body mannequin and we have a full range of those. But not only that, it's very important when you get into clinical education and scenario-based training that sometimes you need to be a lot more focused and condensed on what you're trying to learn about. So that's where things like our clinical trainers come into part. So this is our NHS approved and well-used IV arm. So this allows intravenous access across the whole arm and allows students and even clinical professionals that are just doing their CPD to continue to enhance their skills and make sure that they're always hitting the points that they need to do during their clinical practice. As we move across here, you can see in the bed, this is brand new to the market and it's our bariatric mannequin. Now, interestingly enough, we're in 2024 and this is the first clinically accurate and patient representing bariatric mannequin. And actually, as you can see in our quote there, it is becoming the new norm. Her name's called R42, and although you may not think that's a name, what it stands for is it represents 42% of the American female population, or this size or larger. And the UK and other Western countries are quite close behind. Now, the reason this is important is we're not only training, not every patient you come across is the same size or has the same clinical impacts. So when we start talking about this bariatric training, it is important for new students, clinicians, paramedics, or people who've been on the road a long time to be able to help safeguard and keep the dignity of these patients, but also how they change their clinical ways and practice to allow them to successfully and treat a patient to their needs. And of course, as a final thing that we bring to all emergency shows is Casper the CPR dog. Now you may think that this is a really random object to bring, but what you have to think about now, not only just do vets, but all of your doggy daycares, all of your professional walking services, anybody who has some kind of impact on your pets at home now goes through normally a pet first aid course. So Casper here allows you to practice and hone your skills, taking what you know from human patients into dog patients or any other animal to hone your CPR and mouth to snout skills. So you can reach out to us when we're on the website. So we're all over social media, specifically on LinkedIn, Twitter and Instagram, and you can see the social tags at the top there. The best way to reach out if you want to come to us is simulaids.co.uk or shop@simulaids.co.uk if you want to reach out with an email.